Morning again, folks. It is feels a bit like we're in a nightclub somewhere. I'll show my age on the Golden Mile. Do you remember the Golden Mile? So we're not, because it's 11:45 on Wednesday morning. So welcome to this session, this awards ceremony. You're all very lucky to be here, and this is the big session at this particular time, so I hope you're all comfortable. We're here for the annual HSCQI Awards. 8 awards to present in all. I will talk you through them in a moment or two, but just by way of background, to get the context of what we're doing and why we're doing it and why it's important, I want to invite Dr. Aideen Keeney, who's Director of the HSCQI at the Public Health Agency, to officially welcome you all and to explain how things are going to proceed today. So, welcome.
Thanks, Mark. So good morning, everyone, and welcome to the 2022 HSCQI Awards Celebration and Showcasing event. It is great to see so many of you here today. As you know, this event is being live streamed, so I also want to extend a special welcome to those joining us online. As many of you will know, health and social care quality improvement, more commonly referred to as HSCQI, is a network of people from across many parts of our health and social care system who are committed to using a quality improvement approach when leading change, so that from the ground up, we as a system can support the ongoing transformation of our health and social care system as described in the 10-year strategy for transformation known as Health and Wellbeing 2026 Delivering Together. As the Director of HSCQI, I feel very honoured to stand here today to acknowledge the fantastic improvement work that teams have been leading on over the last 12 months. This is all the more remarkable given the fact that this improvement work has been happening despite the fact that we are living in a time when everything we do is still impacted by the ongoing challenges of COVID-19 and the need to rebuild services. During every interview and presentation within this awards process, it was evident to me that each team, through the application of a quality improvement approach, is committed to continuous improvement, and that these teams always have the patient, service user and carer at the forefront of their minds and at the centre of their improvement work. The 2022 HSCQI Awards attracted a wide range of strong and innovative improvement projects across 8 categories. Make no mistake, agreeing the various category winners was a really difficult process. The standard of the work submitted was exceptional. I have no doubt that members of the judging panels, some of whom are here today, will wholeheartedly concur with me when I say that deciding who the winning team was within each category often required much discussion and deliberation. Interestingly, in equal measure, when speaking to the judges afterwards and asking them to describe their experience of participating in this process, I noticed that many of them used words like uplifting, amazing, emotional, and proud. To me, the fact that the judges used words like these reinforces what I know to be true. That is, that health and social care staff are truly committed and are passionate about improvement. This morning, the Minister for Health launched the first ever HSCQI strategy, Moving Forward, Shaping the Journey. Our vision for this strategy is that HSCQI will inspire and influence Northern Ireland's health and social care community to become a global leader in quality improvement and innovation by working together and focusing on person-centred care. Now, as we all know, there can only be one winning team within each award category. However, I would like to take this opportunity to acknowledge all of the teams who reached the final stage of the awards process, because to me, the work of all of these teams is aligned to the vision set out within our newly launched HSCQI strategy. The future for health and social care is bright. So please join me now in giving all of the teams who reached the final stage of the awards process a well-deserved round of applause. So I now want to thank all the judging panel members who willingly gave of their time to participate in the awards process. I would like to say a special word of welcome to some of them who are here in the room with us today. And they include Aidan Dawson, Chief Executive of the Public Health Agency, Leanne Morgan, Clinical Lead from RQIA, Andrew Dawson, Director of Quality, Regulation and Improvement in the Department of Health, Anne Henderson, Non-Executive Director, Member of the Board of the Public Health Agency, Lorraine Schwanberg, Assistant National Director at the National Quality and Patient Safety Directorate in the Health Service Executive in the Republic of Ireland, and Raymond Curran, Assistant Director of Integrated Care in the Strategic Planning and Performance Group in the Department of Health. I would also like to welcome Peter May, our Permanent Secretary for Health, and Andrew Dougal, Chairman of the Board of the Public Health Agency, who are here with us today. And I also know that we are joined by some other members of the Board of the Public Health Agency, and just to say welcome to them also, and to say that it is really, really lovely to see all of you here today with us. Lastly, I would like to extend a very warm welcome to Dr. Cathy Jack, Chair of the HSCQI Leadership Alliance, and to all the other Alliance members who are here with us today. It is also so lovely to see you all with us. So let's move on now to the main event. Let's recognise and celebrate the winning teams. We will do this by presenting each team with a trophy and giving them an opportunity to briefly describe their improvement work and to share key learning. In doing so, I hope that you, like many of the judges, will also feel inspired and proud, and that you will be able to take away some pearls of wisdom that you can apply to improvement work going on within your own teams and within your organisations. So without further ado, let me pass you over to Mark, our Master of Ceremonies, who I have no doubt will expertly guide us through our celebration and showcasing event. Thank you.
Aidan, thank you very much indeed. Very simple format. As Aidan says, I'm going to invite a VIP presenter to come up to make the announcement of the winners. We'll get the winners to come up. They'll be presented with their prize, their award. And I'll have a quick conversation with them, just a couple of minutes, about the project and about why they think it was successful and about where it might go from here, and then we'll move on to the next one. And at the very end, we'll gather everybody together for some photographs at an appropriate place, either down on the floor or up here, probably up here on the stage. So there are 8 categories, 8 awards to be presented. Let me just run through the 8 categories for you now. Here they are. The first one is using a QI approach to reduce health and social care inequalities, then improving outcomes for patients with COVID-19, patient safety, transformation, staff well-being, care homes, and finally, delivering reliable care, and then finally, improving timely access. So those are the 8 categories we're going to focus on. The first award then is using a QI approach to reduce health and social care inequalities. And I want to invite Aidan Dawson, the CEO of the Public Health Agency, up to the stage for his comments and then to present the award. Aidan.
Thank you, Mark, and thank you, Aidan, for those inspiring words to open the ceremony. I'm honoured to be invited to present the award for the winning project in the using of QI approach to reduce health and social care inequalities category. This award recognises teams who have used a QI approach to reduce inequality and increase equity in service provision. In this category, teams will have used local data to evidence and monitor the impact of service change for targeted populations. I am delighted to confirm the winning project is okay. So the winner is reducing unallocated cases within ARD's child and family teams, carried out in Southeastern Health and Social Services. Please welcome Jessica Anderson, Children's Improvement Lead, and Jason Codwell, Interim Assistant Director for Safeguarding and Family Support, who will accept the award on behalf of their project team.
Aidan, thank you very much indeed. Are you both going to chat to me? Yes, or have you?
What you ask?
No, I'm just going to ask. Don't worry, don't worry. I don't have that hat on today. I'm just going to ask nice questions like, well, you're smiling, so obviously you're very delighted. What do you think it was about this particular project that caught the attention of the judges?
Ooh, good question. To be honest, unallocated cases has been around for 10 plus years across the region. And whilst improvements have happened, nothing's been sustained. I think our approach was just using our existing resources to just bring a collaborative approach to address the problem. And we had really good data, which was, I think, a really strong point of ours, to be able to just evidence the improvements that we were making. It's a really simple project. We are a collaborative, unallocated process group, and I think that was just our strength, that it was a collaboration of a whole team coming together, and we were able to evidence it through our data.
Yeah. I was just going to ask, what, in real terms, in simple terms, for the benefit of people who don't maybe know about this particular project and what it is that you do, what impact does it have on the ground?
Okay, so really the issue is families who need a social worker and don't have an allocated social worker, and they're waiting for a service. So in essence, Mark, what we wanted to do was improve access to services to help families earlier. And to do that, we brought about an understanding of data and working as a team and a collaborative approach to that. And what we were able to do over a period of a year was not only reduce the number of unallocated cases, we also improved the timeliness of access to services. So what does it mean? It means that families got help earlier and they got help at the point of crisis, and we were able then to sustain that support. And kind of just a big shout out to the rest of the team who are sitting over here who were integral in doing that. This is a new and innovative way, Mark, in terms of thinking about how we manage unallocated social work cases.
And is there an application then, Jessica, for this elsewhere, do you think, within the healthcare system? And can you develop this scheme to make it bigger and better in the years ahead?
100%. So within our own trust, we've already managed to scale it out to our other locality teams. So it's across the South Eastern Trust and our Children's Disability Service. But in essence, what it is a waiting list management system, and there's massive scope for that to be adopted. I know, Jason, you're working with our regional unallocated group at looking at how we can roll it out to the other trusts.
So Mark, exciting news actually as of last week. The Health and Social Care Leadership Forum deliver a leadership programme called Proteus. This project has been accepted as a regional scale and spread project, which will be the essence of what we are doing will be taken to address waiting list initiatives across health and social care, not just only social work cases. So very exciting in terms of actually building on our success and how we scale and spread that in the region.
So that is a real challenge. We've already been touching on that, and this is a tangible way of actually helping to make things better. I mean, you'd like the scheme not to be needed, really, ultimately, wouldn't you? You'd like to actually improve the system so that it doesn't exist. But at the moment, there are applications whereby people should benefit tangibly.
Absolutely, Mark. I mean, I think in essence what we're looking to do is get help and services to families earlier. And what we're able to do with a collaborative approach to that is actually look at, well, what way can we address that and meet the needs? Using the data helps us understand the themes and helps us then to redesign services to meet those needs quicker and where they're most needed.
Right, very good. Well, congratulations to you both. Thank you both very much indeed. Enjoy the rest of the day. Thank you. Thank you to Jessica and Jason. And congratulations again to them and to the members of their team. Let's move on to the second award of the day. It's Improving Outcomes for Patients with COVID-19. And to make the presentation, Anne Henderson, Non-Executive Director at the Public Health Agency. Anne.
Thank you very much. This is the second category, Improving Outcomes for Patients with COVID-19. I'm honoured and delighted to be able to award this one. The category recognises teams who have used QI approaches to focus on driving continuous improvements, leading to better treatments, and for patients with COVID-19. I'm delighted to confirm the winning project is it's the X Factor moment. And it is the Nightingale Nutrition and Hydration Matters project carried out in the Northern Trust. And I would like to welcome Heather Owen and Erin O'Hagan, who are both advanced practitioner dietitians, to collect the award on behalf of their team. Thank you.
Right, congratulations, folks. You both happy to chat? Yes, 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 yes. Tell us why this is an outstanding project.
Well, I think when Nightingale White Abbey first opened its doors in November 2020, it was the very first unit of its kind within Northern Ireland. And the patients that had transferred over to Nightingale, they were profoundly weak. They had long hospital stays, some of them in ICU, and had weight loss and really were malnourished. And we know that malnutrition really weakens your whole immune system and really delays recovery. And as dietitians and the whole multidisciplinary team, we want to make sure that the patients were getting the best care possible. And when we were carrying out assessments, we noted that patients weren't really getting enough nutrition and enough protein. And we know that nutrition, protein, and hydration is really vital to help patients really achieve their best goals so they can live well. So the team were passionate, and very adamant that we wanted to make change to really help patients' recovery. So we came together and, just through, as Heather will talk about, through collaboration, through education and sharing ideas, we brought about change to really help patients improve their nutrition and achieve their rehabilitation goals.
And how did you actually promote that change?
So this was a really interesting part of the project. We knew change was needed. We were absolutely passionate about it. So what we did first was got the most important people in the room, or the key people. I don't want to say the most important, but the key people, which was catering managers, nursing managers, AHP managers. And what we did was took the QI methodology and made a really, really clear pathway and process of how we were going to change, how we were going to help nutrition and hydration on our ward. That was almost the easy part. The harder part was getting everybody else on board. So we needed everybody to help with this. We needed our domestics, our catering, our healthcare assistants. We needed nurses and AHPs. And we just got them all together and did really interactive training. So not education, interactive, where we got their ideas, what do they think might work. And we wanted them to see the scale of this problem of nutrition in our ward through their own eyes. We wanted to see what would be the best that they would want for their families. So I think that approach was slightly different, and the results had spoken for themselves. Our weight gain was better, our intake was better, our fluid intake was better, and nutritional supplements were all reduced.
I can just say that, the patient feedback has been outstanding as well. Like, patients have said they've never been fed so well, which is a really great thing, coming away from a hospital, but it's been really rewarding.
And is there further application? I mean, can you develop it, do you think, in the months and years ahead, and can you share your experience with others?
Yeah, malnutrition is a big problem facing the NHS, and thankfully, best nutritional care is on high-level strategies, both locally and regionally and even nationally. So our model of care has worked with our COVID patients, but it also has worked in a fracture rehab model and our general rehab model. So we're absolutely confident that this can be rolled out, and we are doing our best to go on every platform to tell everybody about our brilliant project and all of our results.
and I guess it's just about that, like shining the light on really, the changes you can make, how good nutrition, how good hydration can really help patients' recovery. Because unfortunately, we all know someone, be it in hospital at some stage in our life, or be it even at home, and to know that that person is getting the best nourishment possible to help their recovery, is really, really vital to us. So, yeah.
Well, congratulations to both of you. Enjoy your success, and thank you very much for being with us today. Thank you. Well done to Heather and to Aideen and the team, and thanks to Anne for making the presentation. So the third category is patient safety, and making the presentation, Andrew Dawson, Director of Quality Regulation and Improvement at the Department of Health. Andrew.
Thanks, Mark. I've never given out a prize before, so I'm honoured to be invited to present this award for the winning project in the patient safety category. This award celebrates the use of a QI approach to push the boundaries of patient safety and drive cultural change to minimise risk, enhance quality of care, and ultimately save lives. And I'm delighted to confirm that the winning project is suspense. The arterial line safety project carried out in the Belfast Health and Social Care Trust. To receive the award, it's Dr. Aoibhinn Hutchinson, consultant in intensive care medicine and anaesthesia, and Mr. Mark Eccles, the senior nursing assistant, who accepted the award on behalf of the project team. So congratulations.
Andrew, thank you very much. Congratulations to both of you. Well done. Tell us a bit about the project and why you think it stood out for the judges.
Okay. Well, myself and Mark work in the Regional Intensive Care Unit in the Royal Victoria Hospital. Intensive care takes care of the sickest patients in the hospital, and their lives depend on us delivering safe care. So one of the first things we do when a critically ill patient arrives in ICU with a life-threatening illness is we place an arterial line. And that is essentially a drip that goes into the patient's artery. And it allows us to continuously monitor their blood pressure and also analyse their blood biochemistry to guide their treatment. And every single patient has one, and it's absolutely crucial that we get the setup of this correct. So the drip is attached to a pressurised fluid flush system. That fluid must be a salt-based fluid. If a sugar-based fluid is used in error, then it can contaminate their biochemistry. It can lead staff to think that they've got a very high blood sugar. And then insulin can be administered incorrectly, and the patient can sustain irreversible harm. Now, this has happened in the UK and Ireland and here. It is catastrophic when it happens. It is rare, but it is a very profound problem. So we want to try to make things safer for every single patient that comes into intensive care. And all the fluids look the same, exactly the same. So when you have somebody whisked in critically ill and we're doing 100 things to them to try and save their lives, there is a possibility that somebody can select the wrong fluid. So there's a trust policy about this, about the use of adult arterial lines and how to get it right. But we wanted to make it practically easier for staff to know that risk and to know how to set up every single ART line correctly every single time. So does it matter? Yes, it does. There's 1,300 patients through ICU every year. Every one of them is an ART line, 250 analysis a day. We've got to get it right every time. It matters to the patients, their families, and our team.
Okay. So that's the problem identified, and as a member of the public, I think it's something that you obviously want to get right, and nobody wants a mistake made. What was the solution?
So we, first of all, we got a very diverse, multidisciplinary team together. So there was from myself as a senior nursing auxiliary right up to even as a consultant. And what we done was we condensed, simplified the trust policy into our salt checks and our sugar checks. We also implemented what we called as a universal adult arterial pack. So it was a pack with the fluids, the transducer, the labels, all that was required to set up that pack safely. We also implemented education. So we put up posters in the unit. We also put a leaflet in the pack so that everybody was informed. We had what we call as the arterial line champions. So we had champions there that if you needed a question, especially the senior staff in ICU, so we made sure it was rolled out to those. We come back also, we checked what we were doing, if we were doing something right. We didn't obviously want to put anybody else more at risk. So we kept coming back and checking what we have done, and then before we moved on to the next step.
And when your back is against the wall in A&E, can you see the difference that it's making? Does it make your life easier?
Well, I found with the universal packs, now I make up these packs, and quite a lot of them, like there's probably thousands I've made up within the unit, and I do find that, especially if we have a lot of staff, over COVID especially, we had a lot of new staff that come in that had never seen an arterial line, they weren't 100% sure, so I was literally go to a store, grab this pack, and everything was there explaining what to do.
Does it make your life easier?
Absolutely. I think, as Mark says, it's about giving the people the tools to do things right every time, and it's kind of removing that potential risk for harm. No patient in this room, or no person in this room, or member of staff who comes to work has any intention other than helping patients. But unfortunately, we have multiple interventions, and there's risk in absolutely everything we do. If we can make it easier for staff to do the right thing instead of telling them there's a policy to look at, then that is practically making life easier for me and for the staff involved in my team.
And just very quickly, same question that I asked the others. Finally, presumably there is an application that you can share with colleagues.
Yeah, so our aim is that every single member of staff who uses an adult arterial line knows that risk, and that every arterial line in the Belfast Trust will look identical and is set up according to those steps. So there's an application for theatres, the emergency department, and the other intensive care units. Now, we've already used the educational tools and put them out into those areas to give them the ability to introduce this as well. We've produced an e-learning module as well. There's a real challenge for us, Mark, though, ahead, because these are high acuity areas. They are under massive pressure. There's major staffing deficits. They have huge volumes of patients. So therefore, asking them to do quality improvement work on top of just being able to share day-to-day care is very, very difficult. And that's where our biggest challenge is now at this point in time. But we will try to equip them as best we can. And again, if you're giving them something that could make life easier in the long run, well, then hopefully it will be able to be implemented. But it has got potential across high acuity areas and each of the trusts across the province.
Okay, well, it's good news. Thank you very much indeed for explaining it and highlighting its significance. Congratulations to you and your colleagues, and enjoy the rest of today. Thank you. Evening, Mark. So we're on to the fourth category, which is transformation. And Andrew Dawson is going to come back up from the Department of Health to make the presentation.
So the first one went so well, they asked me to do it again. This is the award for the winning project in the transformation category. And this award celebrates teams who have used a QI approach to improve quality, safety, and effectiveness using new approaches or collaborative or cross-boundary ways of working. And I'm delighted to confirm that the winning project is... You can hold your suspense. The evaluation of a nurse-led, multidisciplinary enhanced care response team into care homes from the Northern Health and Social Care Trust. And I'm delighted that Elizabeth Graham, Assistant Director of Nursing Innovation and Development, and Maria Loughran, Service Improvement Lead Nurse, are here to accept the award on behalf of the project team. Congratulations.
Thank you.
Andrew, thank you very much indeed. Congratulations.
Thank you, Mark.
Tell us a little bit about the project and why you imagine the judges paid particular attention to it.
Thank you, Mark. It's of regional interest, the project that we undertook. Not only what we were able to sustain within Northern Trust, but it's applicable throughout Northern Ireland. We have about 16,000 residents across Northern Ireland who live in nursing and residential homes. And unfortunately, the data shows us that they are very high ED attenders, emergency department attenders. And as well as that, some of those ED attendances are avoidable. So we looked at the data and we read the story behind those attendances at ED and found that with the implementation of a team at an early stage in a resident's deterioration, that we could intervene early upstream and actually avoid that ED attendance for that individual. A lot of our residents are older people, and the last thing we want them to do is to attend an ED unnecessarily. Now, there will be those acute cases where they need ED attention, but for those other examples, if we intervened early, they wouldn't have that distress and anguish, that ambulance journey, that long wait in ED. So that's why it was important to us and for our residents and our population, but also for our emergency services. Our ED departments are beyond capacity, so this released capacity for ED departments and also our ambulance service. So it was important, and I have to say it probably brought Bengoa and transforming your care and delivering together. It translated all of those messages into a system and a team where we delivered care in the community for the community.
So everyone was a winner, effectively.
Yes, indeed. Some of the, I suppose, the key learning or the key successes, Mark, really was always having a clear sense of purpose and vision that everybody bought into. We had a lot of stakeholders between working in partnership with the care homes and the care home staff and the care home managers. The residents' GPs always maintained clinical governance and oversight of their residents' care. We had a true multi-professional, multidisciplinary team going into the care homes with a very high visible presence. We developed a residents' wellness overview tool that included frailty assessment. So we were able to detect residents in early deterioration, and then those referrals were all brought back to a weekly multidisciplinary team meeting where we discussed it with specialist nurses, AHPs, pharmacy staff, clinical psychology staff, and we're able to put together a really truly person-centred integrated care for the residents in the care homes to avoid those ED attendances that Elizabeth referred to.
And in terms of developing this project or rolling it out in other areas, where do you think things might go from here?
Well, during the course of this 15-month project, and I know the data concentrates on 3 main care homes that lived with us throughout that journey, we also scaled that up to another 6 homes within East Antrim, and interestingly to a rural locality in Mid-Ulster with exactly the same outcomes. So we have evaluated this, we've used our data, and we have a very strong evidence-based blueprint which can be used right across other trusts. And actually we have been contributing to some regional pieces of work. One is the Chief Nursing Officers coordinating an enhanced clinical care framework into care homes. We've contributed to that with our knowledge, and also other regional work that's looking at what does a good team look like actually going into care homes. So again, we could contribute our profound information and knowledge into those. And more recently, a range of GPs across Northern Ireland are adopting an enhanced care service which is connecting more into the care home environment. And actually I can see that what we did here, Maria and myself and the team down there, what we have done is we can contribute to that conversation with our GP colleagues. We can contribute to their visit into that care home or their connection with that care home, and actually with our knowledge of the deteriorating resident, make that visit more efficient and effective.
And just finally, Maria, does it feel good to get this kind of recognition? Does that make a difference to you and the team?
It does. It's great to be valued. But I think what's really important is that we kept residents at the centre of everything that we did. We very much worked in partnership with the care homes and with the residents and their families. And it was very much a collaborative, collective approach with a wide, trust colleagues, AHP colleagues, with NIAS, with GP colleagues, with Northern Ireland Hospice, because we had specialist palliative care nurses within that team. So residents at end-of-life care were able to be cared for in their own home, which is where they want to be, and avoid the distress of a hospital admission or an ED attendance, where it's safe and appropriate for them to remain at home. And that really, for all of us, is the most important thing, is fundamental. And it's about delivering true, integrated, person-centred care for frail, older residents, and that's so important.
It certainly is, and it's nice to get the recognition as well that you deserve. So congratulations to you and to the team. Thank you very much indeed.
Thank you.
So, we are now at award number 5, which is for staff well-being. And I want to invite Andrew Dougal, the chairman of the Public Health Agency Board, up onto the platform to make the presentation. Andrew.
Thank you, Mark. Ladies and gentlemen, I'm particularly pleased to be invited to present the award for the winning project in the category of staff well-being. Our greatest resource across the health and social care system is, of course, our staff. This award celebrates teams who have used QI approaches to make measurable improvements in the well-being of the workforce. I'm delighted to confirm the winning project is in the South Eastern Trust, the COVID Recovery and Staff Wellbeing Project. Please welcome Ruth Watson, Clinical Manager, and Karen Hull, Lead Nurse, who will accept the award on behalf of the project team. Many congratulations.
Andrew, thank you. Don't go too far away because you're going to do the next one, I think, as well, aren't you? Yes. You can take my seat. Keep it warm. Congratulations to... You can tell Andrew's very comfortable on a stage, can you? Yeah. Congratulations. Tell us a little bit more about the project.
When you think back to the start of the pandemic, it was a hugely stressful time for everyone, particularly the respiratory wards. The dependency of the patient was much greater with many more aerosol generating procedures. It was very restricted visiting. There were lots of fatalities, not necessarily within our respiratory wards, but regionally, etc. So it was a very, very anxious time. And we just kind of felt that there was a lot of wraparound services, particularly for ICU, and lesser for the respiratory wards. So we put this programme together to help support the team through what was a very difficult time.
And can you give us a sense of what the programme looks like? What did you put in place to make things better and ease that pressure as best you could during a very difficult time, as we all know?
Yeah. I think what was really important was teamwork, Mark, and that was teamwork within the respiratory wards. They were dealing with the unknown. We were dealing with changes every day, even changes to legislation. And these staff were working extremely hard to look after those patients. And in fact, so much enhanced care in the respiratory wards prevented patients going to ICU, which was quite frightening. So what we had to do really with our wellbeing colleagues in the trust was listen and speak to the staff. And some of that was one-to-one, some was focus groups. We actually did questionnaires, which we got a really good response from. And from that then we were able to detail what was for the staff, what they would want. And we had a range of programmes over a period of time that ranged from mindfulness to spaces for listening, which was actually supported by our senior management team within the trust, who then came at the end of that session just to show their solidarity to the team. And also we had a bit of physical activity. We had Feel Good Fridays, so we had a bit of Chai-Me, just to give the staff a sense of just a bit of space for themselves. But the one thing that really impacted was something quite simple. It was called Red and Green Day. So each of the wards took on a project of red and green balls. So they had a set of red balls, a set of green balls, something very simple. And at the end of their day, they evaluated their day by simply placing a ball, whether it was a red ball, today wasn't a good day, or a green ball, today was good. But what was more important was to hear why was it good and why that day was challenging. And then we were able to take that detail away and work with the teams and see. And we had some small wins out of that we were able to develop very quickly. One ward needed a housekeeper just to keep all the PPE and all that. And actually then, how do we know that that was working was from staff feedback, and also a reduce in sickness, in staff sickness. But actually the highlight of it was that these teams were actually able to recruit through the pandemic to their wards. People wanted to come and work with them. such was the teamwork and the sense of involvement. So yeah, it was.
It's very interesting. I'm assuming, am I right, that as the project went on, you ended up with more green balls and fewer red balls?
Yeah. And it was very, very visual, so staff immediately knew at the end of each week, could see the green line accelerating.
Was that obvious? Could everybody see that happening?
Yes, yeah. Very simple idea.
Mm-hmm. Very simple idea, but very effective. And again, at a very difficult time, there was a clear learning experience which can be used in the future. Nobody knows what this autumn and winter holds for any of us, but this is relevant to COVID and COVID management in future if we have to deal with that, but it's relevant presumably across the board.
Yeah, post the project, we've reflected back and learned, whilst we did put together a very comprehensive programme, we were probably too ambitious. So this winter now going in, we are going to offer a talking therapy session where staff can come and openly have a chat with some of the experts, and we will do the red and green balls again. Right.
Well, you've just picked up a very nice award. Presumably today is a green ball day, is it?
Yes, absolutely.
You can go and celebrate. Thank you both very much indeed. Well done. Well done indeed to Ruth and Karen. I can imagine that at next year's NICON conference there'll be a red ball and green ball exercise in some shape or form, if Heather's been listening to that. Okay, Andrew, you're up again. We're going to give the award now for care homes, and you are going to make the presentation.
Mark, the plaudits and acclamation were such that I couldn't resist the encore. I'm really honoured to be invited to present the award for the winning project in the care homes category. This award celebrates excellence and innovation in the care home sector.
Project is about and what made it outstanding?
Yeah. Well, as you can imagine, falls can be particularly devastating for the elderly, not just for the faller themselves, but for their carers and family. And with the COVID isolation, the nursing homes were particularly badly hit, and the residents suffered from less activity and deconditioning, so there was increased risk of falls. The key thing is, though, that falls can be prevented, and it requires a targeted multidisciplinary approach, looking at things like encouraging safer mobility with appropriate physio and strength and balance, improving nutrition, addressing factors like lighting, footwear, reducing unnecessary medications, etc., etc. So using a QI approach and involving fantastic input from our pilot nursing homes, we agreed a pathway to help the nursing home staff and healthcare professionals in the prevention and management of falls. And not only did this reduce falls, but it improves the quality of life of the residents because it increases their activity, it reduces their fear of falling. It also led to a reduction in 999 calls and A&E attendances, which are particularly traumatic for the elderly population. So it was a real win-win.
Yeah, which is similar to what we've been talking about already. One, and I don't want to underplay it, but one, as you've said yourself, Chris, relatively simple approach actually pays big dividends across the board.
No, absolutely, and I think in terms of paying dividends, we've heard from Chris about the system savings and the system pressures that we're all under and contributing to lessening that ED attendance. But what was so important about this project was it was about the resident and it was about their quality of life. And we used really innovative techniques and methodology to hear those voices that we don't normally hear. Because when you're planning any quality improvement, service improvement, it has to be what that person needs and not what senior management around a table needs. So I think one of the things that was really key was the collective approach with the resident at the heart of it.
That's very interesting. Did everybody buy into it straight away? Did everybody get it?
I think there was a lot of collaboration and discussion. So the buy-in was fantastic, you know, and we had some specifically good examples of people who really embraced it. And we used those because there is a little bit of work, and the more people use the tools, the quicker, the easier it is to use. So we used that and we shared those stories, and I think the results themselves, and using the QI methodology, because the thing is, you don't see the falls you prevent. So to show that you are preventing falls is the greatest motivation.
And just finally, Ciara, are there lessons that can be, well, clearly lessons have been learned, but can those lessons be shared with others?
I suppose just firstly from a quality improvement perspective, I think the most important thing is having that collective stakeholder involvement from the get-go. So we got everybody to decide with a blank page what they wanted and what they needed. I would say that first of all is so important, and learning to bring forward. But also I think as well, it's about making sure, we talked about patient centrality this morning, and it's making sure that what we're doing is we're seeing outcomes for those residents and those very vulnerable people in our society. In terms of rollout, we were very ambitious. So we had 18 care homes involved in this project across Northern Ireland. So our next steps, and we've got a sustainability spread plan to actually see about how we can make this custom and practice.
Which would be great. And it's lovely. You can't put a figure on it, of course, as you said, Chris, but to think about the people who didn't have to go to hospital because they didn't fall.
Yeah, well, we saw a reduction, I think, of about 30%, which was fantastic. And as well as rolling it out, we want to, I mean, there is a big need to develop alternatives to A&E for our frail elderly patients. So we're working with the southern area in having a mobile screening unit so that, you know, where there's a suspected fracture, they can have that done in the home and then go direct to a fracture clinic or whatever be addressed. There was also some evidence that looked at the management of patients who were on blood thinners or anticoagulants that we've submitted to the NICE guidelines, which we might think might support a more cautious, observed, wait-and-see approach in very vulnerable patients. So there's a lot of positive spin-offs from the project.
Well, congratulations. Do you want to make? You can, of course.
I just want to say a massive thank you to the guys here at these two tables who, without them keeping it going, and particularly our care home partners who, despite going through COVID and the challenges the last 18 months, they stayed with the project, and it's to them that we're indebted.
Absolutely.
Well, they can share in your pleasure and your excitement at winning today. Congratulations. Thank you very much indeed, Chris and Ciara, for being with us. And congratulations to everybody else as well.
So, our penultimate award is delivering reliable care, and Anne Henderson did such a brilliant job the last time that we're going to ask her to come back and make this presentation as well.
Thank you very much, Mark. Also my second time giving an award, Andrew. I'm very honoured to be invited to present this award, and the category of delivering reliable care recognises the use of a QI approach to help reduce defects in care processes, increase the consistency with which appropriate care is delivered, and of course improve patient outcomes. So I am delighted to confirm that the winning project is, and is it going to come up?
Oh yeah.
And it is the intrathecal opioid driving surgical change project, and was carried out in the Northern Health and Social Care Trust. And can I welcome Dr. Ciara Mitchell, consultant anaesthetist, and Dr. Lindsay Nelson, physician associate.
Thank you very much indeed, Anne. Congratulations to both of you. Right, talk us through the project.
So in Causeway Hospital, a significant number of our patients were experiencing a delayed return of bowel function after elective colorectal surgery or bowel surgery, which was associated with a prolonged length of stay, which is bad for patients, staff and the organisation. So the aim of our project was to encourage an earlier return of bowel function and reduce the post-operative length of stay. So the first thing we did was introduce intrathecal opiates, which is an injection into the lower part of the patient's back into the fluid around the spine to provide excellent pain relief and reduced side effects compared to other forms of pain relief. We also created guidelines, delivered an extensive teaching programme and reduced post-operative morphine use. We collected our data, presented it on run charts, and we had an impressive reduction in our median post-operative length of stay from 10.5 to 6 days, which is clear benefits to the patient. There was also an unintended reduction in staff-reported workload and improvement in morale. And with an average cost saving of over £1,500 per patient, this multiplies up to over £165,000 per year. There's clear benefits to the organisation.
That's very good. I felt like I was being pitched there. Dragon's Den almost. That's you'd thought about that, hadn't you? Yeah. No, very good. And again, what's interesting about that is it's the win-win, isn't it? It's that the patient benefits, but the staff benefit as well, and the hospital benefits too.
Yeah, absolutely. Our patients really had a positive outcome. We did a number of kind of patient feedbacks following the project, and they were definitely happy. Certainly, it had a number of other effects as well in terms of post-operative complications, such as post-operative ileus, where they need a tube put into the stomach to drain any fluid away. And I think it was 25% we reduced that by, and it had been known from previous studies that that was one of the major things that was a negative outcome of their admissions, so we really improved their outcomes.
So again, in terms of rolling it out, sharing it with colleagues, you talked about this being at Causeway specifically, is that right?
Yes.
So you can roll it out to others, presumably?
So this was in the elective surgical unit in the Causeway Hospital, and we proudly and clearly presented our successes on run charts on the board, and the success spread by word of mouth. So we have already scaled this up across the site, from the elective surgical unit to the emergency surgical unit and to the gynecology unit, and we have shared our resources with the other site to facilitate trust-wide spread. Obviously, if there's a regional approach to standardising care and reducing variation for patients undergoing bowel surgery, this would further improve